Good morning, everybody. So I'm Dr. Daphna from Ion Medical, and we're going to discuss the development of new treatment for corneal edema. I suppose everybody here know what is corneal edema, and today we used to treat corneal edema by an operation which is depend on donor. We have to get tissue from a human donor. And with the advance of the operations today, we started to do operations which are called DSEC and DMEC, which is actually using only the inferior part of the cornea, or only the cornea, the part of the cornea which is not functioning, which is basically the endothelium, which is here, instead of substituting the whole organ or the whole cornea. In our development, we developed a silicone foil, which actually intend to substitute the need for corneal donor, and we put it in the same place as it's been done when using normal tissue. So here you can see the implant, which is outside of the eye. Here it is tinted blue for better visualization. Of course, the implant is totally transparent. Here you can see the implant inside the cornea of a rabbit. Of course, it is underneath, it is inside the eye. And here in an OCT, black and white, and the color one, and here is histology. You can see the implant. So until today, we have more than 50 animals experience with the EndoArt. And this is our general experience. First, we create the model by taking out the endothelium, and by that creating corneal edema. Afterwards, there is corneal edema, we implant our implant, and then we see this reaction, which is actually unanimously reaction. Every time the implant is well attached, we see a reduction during the first weeks and days from huge corneal edema here in rabbits. This is after 12 days, and you see after 19 days the thickness of the cornea comes back to normal, and you can see the implant, which is actually, this is the posterior part of the implant, and this is the anterior part of the implant, well attached and applanated on the cornea. This is a movie of the implantation in rabbits. It is very similar to the operation in humans, just the difference that you don't have the whole delicate part of functioning with manipulating a donor tissue. You can actually hold it with your forceps, push it into the eye, and the operation can take several minutes. Also, you don't have to use suture, you can use a small incision operation, which gives another advantage. So, in general, we had a lot of good experience in rabbits, and we did some GLP studies, and then because of the notion that rabbits' endothelium might regenerate, we also moved into pigs. And in pigs, we got the same situation. Here you can see the same reaction. Here you can see a control eye, half a year, that the endothelium was removed, and no implant was implanted, as compared to an eye where the implant was implanted. You can actually see how transparent and well observed is the pupil. This is a corneal thickness map made by an OCT 6 months after the operation in pigs. And you can see the untreated eye of the same pig, which the central thickness is 671 microns, compared to the treated eye, which is 798 microns. Actually, the difference is the difference in the implant thickness that we used at that time. This is the histology half a year after the operation. And it is well observed. Here you can see the implant. It's a bit distorted by the histological process, but you can see the keratocytes. There is no difference between this histology and to a control eye. You can see the epithelium well organized, and it doesn't look like the eye has a challenge using the implant in its latest version. This is 1 year post-op of a pig. And to conclude our animal phase, we had the complication that we used to have in the animal phase is mainly detachment of the implant in about 30%. We thought that a lot of the implantment is due to the fact that the animal immediately it finished the part of the anesthesia, it starts to run, as opposed to human. We were expecting to have better results in human. Regarding other reaction in the eye, we used to have anterior synephia from time to time, mainly in rabbits. The operation in rabbits is quite complicated, and actually there was no difference between control eye and the implanted eye, so this is mainly on operational reasons. Transient inflammation, which was treated with steroid. And when we treated one rabbit, in a specific rabbit with an implant which was oversized, much bigger than what we use today, we had one perforation. And in these rabbits, we actually, obviously, sealed the nutrition pathway to the cornea. So after getting all the right improvement and all the experience from pigs, we moved into human, and actually we are honored to have Professor Libertovsky and Kaiserman here, which led the implantation in Ashkelon Hospital in Barzilai. And there we implanted 2 patients. Both of the patients were selected with low visual potential in order, so that means that even though we saw an improvement in corneal edema, don't expect to have a marked improvement in vision. Nevertheless, patient 1 was improved from hand motion to 660, and patient 2 improved from finger count to 675. And you see the reduction in corneal thickness, 720 to 580 microns, and 795 to 605. In both patients, the implant was attached for 4 weeks, and then it was detached. Several attempts were made in order to reattach, so-called rebubble procedure, and the implant detached again, and then we actually continued with a normal DSEC. Both of these patients, as far as I know, actually healed good from the second operation. If there's new information, our colleagues can tell us. And here you can see one of the patients. This is before implantation. And you can see 1 day after implantation. Corneal surgeon knows that even in DMEC, which is relatively faster healing procedure than DSEC, you don't see such a remarked improvement 1 day post-operation. And this is logic, because our implant is not a tissue which has to heal and regenerate, and it doesn't have endothelial cells which are shocked from the harvesting and refrigerating. So the implant immediately, when it is attached, it starts to do its function by blocking the fluid to go into the cornea. And that's why we have very fast improvement. And just a small story, I came to the ward to see the patient 1 day after the operation, and the ward there is circular. You can make a complete circle. And I tell the patient, please sit here, I want to ask permission to check you. And I get the permission, I want to see the patient, and he's not there anymore. I find him walking around and say, please sit here. I get another permission, and he's still not there. So what are you doing? Why can't you sit? He says, I have to check my new eye, I can see. And that was 1 day post-operation, and for me it was very exciting. So,
sorry, in the 30% of the detachment in the pigs in animal, you have a second procedure in this group or no?
Yeah, we did.
Because normally you can have in human this complication, but it's possible to have a second.
Yes, yes, we did, and it will detach also after the second and third rebubbling. We decided that even if we halted the investigation for a while, the research for a while, because we thought that even if we will have a good results in the sixth patient, it's not the percentage we want to get. So we understood we need to improve the implant has an adhesive coating. We need to improve that adhesive coating. There is a movie here, which I don't know why it doesn't say here. So this is the implantation which was made by Professor Libertovsky, and it's actually again look the same like a dissecom preparation. First, taking out the sick endothelium and implanting the implant. So we believe, first, we feel that we found a new way or a new possibility to treat corneal edema, which was maybe was not thought as possible prior to this experience. We think that we proved the human model, at least for the short time, that it is possible, and it's actually functioning very well. We have more questions for the long run, and I'm sure that every corneal surgeon knows that there might be some things that will surprise us in the future. But we are very encouraged with the results of 1 year with pigs and with the histology that we did, that actually gives us a lot of motivation and comfort to continue forward. And actually now we improved the implant and the coating, and we are just about to continue our experiment.